joined us this evening. I'm the Chief Clinical Transformation Officer at PHT, and I'm joined on the call by a number of colleagues who have been working hard to bring the latest technology into play, which is our new patient portal. So we're really pleased to welcome you today to this special webinar introducing our new patient portal. And whether you're joining us from home, work, or somewhere in between, thank you so much for taking the time to be with us. I guess I want just to start the presentation before I hand over to my colleagues to point out that technology can sometimes feel a bit daunting, especially when it's new, but today's session is really designed to be clear and to support colleagues and patients and carers in a way that works for everyone. There isn't going to be a lot of technical jargon, there's no pressure, just practical guidance and a chance to showcase how this portal will help our staff and our patients and those that care for our patients how to use the system and to be really familiar with what it can bring in terms of benefits. You'll see through the presentation how you'll be able to access appointments, messages, and access your health information in one secure place, and it will help you be able to link with those colleagues in and out the hospital. So this is about making life a little bit simpler, not more complicated, and the team here this evening are going to walk you through what our new portal would look like. So without further ado, I'm going to hand you over to the team that's going to talk you through our new patient portal.
So thank you very much, everyone. We've also got a number of our clinical colleagues available here today who will be able to answer questions you might have about the portal. I'm Shahid Sada, I'm the workstream lead for the PPUK, which is our patient portal. The brand it has is My Alex Health, and that's the logo you'll see in the top left corner. We've got quite a number of colleagues. I won't introduce them all individually, but they'll introduce themselves as we continue the conversation. And I know we've got quite a number of our staff here today, and I'm sure you'll also have questions. So please don't be shy about putting your hand up and talking. It might encourage and support members of the public who are here to also ask questions. So most of the time we're talking today, we're going to try and give it over to you guys for you to ask questions that you might have. But we're going to really briefly talk without too much jargon, we hope, about the benefits of this patient portal, which is essentially really, if you think about it as a house where all of your records are stored, you're looking in at that house through a window. And the patient portal is that window you're looking in to that house from, and it essentially allows you to see all of the information we hold about you. It's an easier way to manage your care. So in the past, what you would have had is perhaps access to some letters. What this is going to give you once you're accessing it is a way of managing your care, so you can see a much wider range of information. And in the future, we'll be continuing to develop this system so that there's more ways in which you can use My Alex Health. So if we click on to the next slide. So these are ideas really, I think, which are about how the NHS is changing. In the past, very often you would have received your letters on paper, and what it's described as on this screen is analog. So you get something through the post. All of that is now shifting to screens if you want it to. One of the things to remember is we're not going to make anybody switch from paper to digital. We want you to come with us. So you have choices. When you sign up to the portal, you can say, I want to have a completely paperless experience. I don't want anybody posting letters through my letterbox. I want to be able to see it live and in real time on the screen. Or, of course, there will be some members of your family, yourself perhaps, you might think, actually, I just want the confidence and reassurance of a letter, but eventually I'll switch to the paperless. So that's that first idea, analog to digital. The second idea is switching from sickness to prevention. One of the criticisms I think the NHS has often had is we only answer when something goes wrong. And what we want to be able to do is really be much more proactive. We want to be able to respond to you and work with you when you're in good health and we can give you some support and ideas to stay healthy and, of course, prevent you from coming into hospital. Most people don't really want to be in hospital. We know that there are all kinds of challenges around parking your car or getting your relatives to visit. There are all kinds of situations in which actually you don't want to be in hospital. You want to be close to your home, and you want to be somewhere where you feel safe. And usually that's closer to your home in your community. So that's the second idea. And then the last idea is this idea of switching from acute to community. Very often, we receive thousands and thousands of compliments from our patients every year. And one of the things they say most often, which that positive feedback relates to, is if only we could provide care closer to where I live in my community. And many of you will know we have hospitals in Herts and Essex, the Herts and Essex Hospital towards Bishop Stortford, and we have a hospital in Epping, which is St Margaret's Hospital. The feedback we get about those environments is much more positive because people are not travelling too far. It's easier to find some way of getting to that location, be it public transport or by bike or walking. And it's an environment which they're familiar with. They see places, they see friends, they see family in those areas because it's closer to their home. And that really makes it a better experience for them. And that's one of the third shift that's taking place. We're shifting our care from a centralized hospital with everything coming out of it and everything being provided in one place to multiple places. And that's that last shift, acute to community. So if you move on from this slide. So I've introduced myself, Shahid Sadar. So it's called My Alex Health. And the reason we called it that was because the electronic health record inside our organization is called Alex Health. And so we essentially, for simplicity, bolted on the word my at the beginning. So it feels like it's owned by you. So when you open up the web portal, you're able to see that logo, My Alex Health. So, and whenever you're looking at the web portal, when you see that logo, that should give you the reassurance this is the secure web-based digital service which allows you to access your records. And remember, it's web-based, so you could open up any web browser and be able to access this data. It's not an app. You don't have to download it. It doesn't need any kind of special phone. It doesn't need you to be using Android or iOS. If you're using an Apple device, you can just use it on any internet browser that you have on your PC at home. And that the benefit of that is it creates the ability for people to access it wherever they are. It's independent of browsers and systems and environments. It's any browser can access it. So if we move on to the next slide. So Jim mentioned this earlier, our Chief Digital Transformation Officer. These are some of the things that My Alex Health enables you to do. So the first thing is viewing your hospital appointments digitally. Now, many of you will already be able to do that, but there's some benefit of additional functionality there. And one of the reasons we're encouraging people to sign up is very often when we are sending you paper letters, we might need to change your appointment very quickly after we've initially scheduled it. Perhaps the time slot has become unavailable. Perhaps that date has become unavailable. So we send you a further letter. One of the challenges with that is you receive multiple letters. And it's really easy to get confused about, well, actually, I received 2 letters. One says one time, one says another time. Which one is it? Which I need to pay attention to. The benefit of digital is the latest information is right at the top. And that way, you know, this is the latest information. This is what I need to pay attention to. So that's another reason why using digital is really, really useful and effective for people. It gives you the latest information. It's much easier for you to get to the right appointment at the right time. You confirm your attendance. So you can click on a button which says I confirm attendance. You'll receive appointment reminders via text message. And some of the newer functionality is completing assessments and questionnaires. Now, many of our clinicians are often wanting to gather information about your current health and well-being, your symptoms, whether or not you've deteriorated or you're improved through assessments before you come into the hospital, and it helps them to prepare for before you get here. This is a really critical piece of functionality. Sorry to use a jargon word, but it's a critical way of us gathering more information about you before you come into our hospital. Now, I know many of you are colleagues who work at the Princess Alexandra Hospital, but for members of the public here, it's essentially the ability to determine whether or not you're acutely unwell, or you've deteriorated and you need to come in faster, or actually perhaps you're feeling quite well and it's not so urgent as coming in immediately. So it allows us to gather that information without you having to come into the hospital. Then some of these other pieces which are going to help everyone is the ability to view test results. And I'm going to talk a little bit more about that in a moment. And to view reports and clinical documents. So, for example, when you've been discharged from the hospital, you'll be able to see those kinds of documents, correspondence, you'll be able to see that kind of document, and health record information. So, for example, if you have allergies, family history, that kind of information will also be in the record. So if you see something which is incorrect, you can let us know and we can correct it. So it makes all of that information much more transparent, and it allows you to manage your care better, allows us to understand you better. So if we move on to the next slide. So this is the detail of those results. So one of the things to really understand here is some of this information will be available immediately to you. And this is really putting the power in your hands to manage your care. When we do your blood tests, you'll be able to see, potentially before anyone else sees it, the results of your blood test, and you'll be able to act on it immediately. And that really allows you to be aware and to think about, well, actually, what do I need to do about my own health? One of the things we really want everyone to be doing is to take ownership of actually what's going on for them. The way that data is presented are a series of numbers, but just to give you some assurance, there are links within those results which you can go to, which show you what those numbers mean. So if there's a range that's reported or a specific number that's reported within that range, you can click on a link and it'll tell you, what does this mean? And is it something that I should be looking at in a little bit more depth? Do I want to speak to my GP about it, or is it something which actually it's fine? Some of these reports aren't available immediately, and those are reports where we need a clinical eye on those issues, and we need to be able to interpret that data and to be able to give you the best possible care as a result of that. That's clearly some of the more challenging diagnostics that we need to do. And if you have questions about that, please do let us know. And there are, of course, some reports which we don't record in the portal, but you can access through in other ways through your health record. But some data is not reported because it wouldn't be appropriate to have that in these kinds of systems. So if you move on to the next slide. So this is a really positive and kind of encouraging slide, certainly for Princess Alexandra Hospital and for our patients too. So of the people who we've invited to register on the patient portal, an incredible 98.1% of them have registered for the portal. I got a wow there, so that's really good. We're getting public interaction. So that's around 25,000 people have been invited. 24,523, as you can see on the screen, registered. That's really incredible, and we just want to thank our Harlow community. To be honest, we haven't had an opportunity to do that. We are really, really grateful to everyone who's registered, and we want to maintain that momentum. Hence today's virtual public engagement. We want you to speak to your friends, speak to your family. If you use the portal and you're thinking, this is working, it makes sense for me, I really like the fact I've got this information at my fingertips, please tell your family and friends. Let's get that to 99.99%, and really promote the fact that it's been so successful. One of the things it also tells us is that our community is ready for digital, and clearly people want to access their data. So if you think, actually, I know a community who Shahid, Jim, and their team could reach out to and have a conversation with, please let us know. We'd love to come out and talk to people in person and explain how the patient portal works, how you can get registered, and we're willing to spend as much time as is needed to make sure that happens. Because one of the challenges, which I'm very aware of, and I know my colleagues are too, is there are some people who might feel excluded from this kind of system. They might be fearful that I might break the system, I might put in incorrect information, I might access it and lose control of my access to it. And we'll be able to give you the reassurances that actually, no, you can't really break the system. You're not going to be able to edit that information. And actually, there are very clear ways of maintaining your privacy and security when you're accessing it. So thank you is kind of our main message. We love the fact that so many people have signed up and such a high percentage have signed up. And the other message is, please let us know if you think there are particular groups or people who you want us to talk to or visit, or areas, and we'd love to come out and speak to them. If you haven't registered yet, dare I say it, are there some people who haven't registered on the call? The critical thing to know about registering, and I know my colleagues will be looking at me and thinking, is he going to tell them that actually you can only get registered once you get an invitation and you're in a live pathway? Well, I'm going to explain that. It's maybe too much detail, but just to say it quite as simply as possible, really, you're only going to get an invitation to register and have access to the patient portal once you're having active care in the organization. Until that happens, so for example, you haven't been invited along to an appointment recently, you'll when you try to register, you'll get very limited information. You'll probably get access to the NHS app, but it won't have very much information in it. You might get some questionnaires, but actually the critical moment is when you get invited for an appointment. That's when you'll really be able to engage with it, and you'll get access to all of the wider information on the portal. But there is a QR code at the bottom of the screen. If you haven't registered and you want to do that, please do scan it and get registered. Let's move on to the next slide. So really, the summary message is this idea that one of the things we know is communication. Communication is critical in us providing outstanding care to you. If we don't do that, everything else falls down. And My Alex Health is a way of us enabling that. So when you're talking to your friends and family, perhaps who haven't registered, who could be registered, or they've chosen, actually I'm going to go with paper, I don't want to try digital, it's a bit scary, please do encourage them, talk to them about the webinars that we're running, tell them, please join. You can ask questions here. We've got all of the expertise from our colleagues who can answer any questions and provide reassurances that you might need. If we move on to the next slide. This kind of is going to give us some of the detail of what the screens look like. When you're trying to register, you can see the web address at the top of the screen. So it's myalexhealth.pah.nhs.uk. And you would be presented with a screen which, if you've used the NHS app, some of the colors and the buttons will be familiar. And it's essentially a way of registering through the website. If you've already registered for the NHS app, you'll be able to do this much more easily, because you'll go to your NHS login and then you'll get access to My Alex Health. But if you haven't done that, then you can do that with the buttons on the right hand side of this little screen that you can see here: login with username or register with username. Of course, we encourage you to log in whichever way feels easiest for you, that you feel greatest confidence in. If you feel like, actually, I'd have greatest confidence if I'd use my NHS login, that's fine. But equally, you can do that using the My Alex Health portal directly. And as you can see on the right-hand side of the screen, that's what it would look like, with the logo at the top and then information about appointments at the bottom. If we click onto the next slide. And then there's a series of screens here. So this just helps for everyone to see. Actually, it's a really clear process. You would accept the terms and conditions in your second screen, enter your date of birth, enter your email address. The next slide. And then create a password, add your mobile phone number, and then when you add your mobile phone number, you'd get a code. This is the what's known as two-factor authentication. So it's essentially about making sure you're the only person who's going to be able to access this system, because only you would receive the code that comes to your mobile. And then once you've clicked that, you'll get through to the consent page, which is the last little screen on your right-hand side of the 4 screens. If you click yes, I agree to the terms and conditions, and that's really about messaging, email, and the NHS app, you go through to the penultimate page, which is the first one on this screen. And what we would encourage you to do is to click paperless letters, because one of the things which we know is going to save the NHS a huge amount of money now and in the longer term is for all of our patients to receive their healthcare information through the digital apps like this patient portal, MyXHealth. So we'd encourage you to click paperless, and then that will save us money, and it will also make the process of you getting information about your care more efficient. And then the last screen you can see on this slide is choosing a language. So you can choose a language other than English, and you can see there listed Arabic, simplified Chinese, French. So it's accessible to people in different languages. So then your registration is complete. Really necessary just to make sure that we're giving access to the portal to patients, and making sure that it is the right patient. We're not giving away access to people who are perhaps trying to use your data incorrectly. And then here you've got that screen which comes up when you're logging in. So you log in by entering your email address and then your password. If we go into the next screen, and then that second web page that you can see on this slide is what would appear. And you can see the whole range of different functions which are going to be available. Hopefully that gives you a quick run through and a little bit of clarity, makes familiar something which might feel a little bit scary, and you might think, well, I'm not sure I want to try it. That should give you a sense of actually it's a relatively straightforward, simple system to use and easy to get signed up for. So if we go on to the next slide, I think we're just going to summarize some of the specialties which we've got live, which you can read there. So you can see the majority of our specialties are now live. We've got a few more to go, and there I think some of those are on the next slide if we move on. And essentially this just tells you those specialties are not yet live. We're working through them. If you do receive an invitation to register, it will be from NHS PHT, as you can see in the pink coloured box on the right hand side. We're also still running some previous systems, which is Dr. Doctor, and you can see the text number which those might come from. So both of those are secure and you can feel safe clicking on those texts. The next slide. So as I was saying, really the critical thing for us now is to make sure all of the specialties which remain get set up and you're able to access them. We work with you as our local residents and community to make sure you're able to access this kind of patient portal. Talk to us about what you think works, what you think doesn't work. We're really open to hearing from you about that. We want to make sure people are able to access it. So if there are features which you think actually, you know, we need to see in the portal, please let us know. We are working on things like proxy functionality, which is this idea of somebody being able to manage your records, working with you, a trusted individual, perhaps a family member or a friend who is helping you to make sure you can access the record. And there's a lot of other functionality and ways of making your ability to access your healthcare easier coming. And we really, really are looking for people to work with us on that. If you have ideas about that, if you want to work with us in person, come and talk to us. We would love to hear from you. Next slide. So really, that's it. I realize we've spoken a lot. We started at 6:15. It's now 6:40. So we've got another 20 minutes at least, and we're happy to stay on as long as we need to answer people's questions. So if you'd like to ask a question, please just put up your hand and we will try our best. We've got 31 people on the call, mix of members of the public and members of staff. So I would expect some members of our staff to put their hands up first just to get things going and help our members of the public to understand what the benefits of the patient portal could be. So over to you all. Please do just pop your hand up or comment in the chat if you want to, if that feels more comfortable. And we're happy to answer any questions. We'll field them.
Shahid, there is a question in the chat that has been answered. I don't know whether you want to just read it for people if they haven't seen it. Course.
So we've got a question which is there any overlap with the results in the NHS app? And if someone sees an abnormal result coming up and not heard from any healthcare professional, who should they be contacting about it? So NICE has already responded. The results in the NHS app should reflect the results in the patient portal. So PH results, not GP results. And I guess one of the things that we've been really careful to address is conversations we've had with our GP colleagues, through conversations we've had with our clinicians here about safety netting, putting comments in reports which go back, which are about making sure you have a conversation with your healthcare professional when you're reading those results. The other thing to note is that when a result appears in MyAlex Health, you won't get a text message alert to let you know that the result has been reported. It will simply appear in the app, and you'd only find that result if you are proactively going out and searching for it. Helen, do you want to come in at that point?
Yeah, I was just going
introduce yourself and just not everyone will
Hi
know
there.
you.
I'm Helen Pardo. I'm a consultant colorectal surgeon and Chief Clinical Information Officer. And thank you for organising this session. As you say, we've got 24,000 people signed up to the app, but we definitely aspire to have a lot more. What we know is that if a healthcare professional recommends to a patient that the app is worth using and looking at, that encourages them to actually use the app. And every person can influence a minimum of 10 people around them of their local circle. So do encourage your friends, your family, and any people from Prince Alexandra, when you're at work, every patient interaction, encourage and reassure your patients. Certainly at Cambridge Hospital, they have a whole load of the patients really use their portal, and that's what we want to encourage for everyone. So thank you.
Fantastic. Any other questions? So we can see Jane, you've got your hand up. Go for it.
Thanks. Hi everyone, I'm Jane. I'm a consultant in palliative care at the hospital. I just wondered, is there the option for patients to choose appointment slots within the portal?
Shall I hand that to one of my colleagues? Naifa, do you want to come in on that?
Apologies, I was reading the message in the chat. Could you repeat that, please?
Jane was asking, is the...
I can answer that.
Yeah, go for it.
At present, you have the facility to cancel your appointment or reschedule, but you haven't got the, you can't cancel it. You can reschedule it or request a reschedule, but you can't choose the date. The outpatients team will have to reschedule it for you. So you can request a reschedule, but you can't cancel and you can't book your own appointment at present. But the more people we get involved, that's a functionality we really want to develop.
Absolutely. And there are specialties which we're working with now who want to start piloting that. So that's coming very, very soon. And I know we've got Nisa and Donna on our call today, so they may well want to comment at some point once we've answered some more questions. Other questions from colleagues or from members of the public? Really important to get questions from members of the public. So if any of you are members of the public and not PAH staff, please do ask a question, because it's really important that we get your voices in the room. Have we got any questions from members of the public? Please don't be shy. I'm looking through the list and I can see mostly it's the Princess Alexandra Hospital, which is brilliant. It's great to have lots of interest from staff. Much appreciated. Okay, so staff, do staff have any questions in that case?
Hello. I'd like to ask
hi,
a question
Kamita.
about, hi, good evening.
Go for
Thanks
it,
for the
yes.
presentation. So clinic letters, how soon are they visible to the patient on the portal?
So Nisa, do you want to respond?
There'd be much of a delay to clinic letters going into the portal once they're published within Alex Health. So anything that's in the portal is generally taken from Alex Health electronic health record to be able to show within the portal. There shouldn't be much of a delay.
Yeah, it might be a few minutes at the most, nothing more than that. So you should receive things like discharge summaries, appointment letters as soon as they are published into Alex Health.
I have a question. If the patient chooses to receive letters, how do these letters reach the patient? Are they printed somewhere by outpatients department, or who is dealing with that, secretariat? Or
yeah, so as now we have a paper mailing provider, which is essentially a company which prints our letters for us and sends them out. So there's no change to us sending out printed letters if people want printed letters. So when we were looking at that screen earlier, which said go paperless or retain paper, if you click go paperless, then you'll of course not receive any letters in the post. But if you say you want to have paper, then of course you will receive paper. And there's no we're not saying to people, no, you're never allowed to receive paper ever again. But essentially we know it will have a huge positive effect on us from a financial perspective if we have more of our patients choosing paperless. And it's one of the main benefits, we hope, of the patient portal, and allows us to reinvest that money in frontline clinical care.
It's more relevant to people of advanced age in their 90s who don't register on the portal. So it means
absolutely,
they automatically
no change.
Receive their letters by post.
By paper, absolutely. Yeah, and I agree with you, Kamita. Like, I mean, one of the things to think about is we know that actually in our local community, it doesn't matter how old you are, we have huge numbers of people, 90s, any age, who are registering for the patient portal. So I think the challenge for us, you're right, though, is if someone feels that, no, I want to retain paper for whatever reason, we're not going to stop them from doing that. But thank you for your question.
Yeah. No worries. Thank you.
So Joy, I think you've got a question. Hi, good evening, everyone. Can I inquire if this has been tried by active members attending the emergency department? I would like to find out if they received the blood result, for example, save time. It is reflected on Alex Health. Thank you. So Joy, one of the things we did when we were developing the patient portal is do some testing. When we were preparing to go live, we had members of the patient panel who checked whether or not that data came back, and we didn't roll the system out until we were confident that worked. If you have questions which are about something which has happened that you've tested on the portal which you thought didn't quite work, or you didn't get some result in time and you thought actually no, that didn't work, please let us know. We'd love to hear about that. We can make sure we can address those issues. But yeah, in general, people should be receiving their blood results immediately. So if you're waiting in the emergency department, you've had a blood panel, you should be able to get the data back probably before a clinician sees it. So that's one of the things we've talked to our clinicians about, that actually we need to provide additional reassurance and counselling to our patients who are having their bloods done, so that they come to us first and they talk to us about the results that they get. But the reality is, and I think one of the things that as an organization we need to be aware of, this is patients' information. This is the patient's data. They own this data. It's not our data. So it's absolutely right that they should have access to it immediately. The history of us essentially having control of that data is gone. This is a completely new era. We want patients to be much more proactive. We want them to own their data. We want them to challenge us about it. We want them to ask questions. If something's not right, they need to be saying to us, this is not correct. I want you to address this. So it's really something we as an organization need to be prepared for. We want active patients. So that's something to really think about for all of us. We're all involved in healthcare in different ways. The majority of the people on this call, I know there's some members of the public, but we want you as members of the public to access to your data. So Helen's also answered that. So what else do we have? We've got Andrew Stuttle saying there's some further engagement at Birchwood High School on 30th of September. Joy is saying, I'm assuming that if we discharge a patient and generate patient discharge summary as per workflow, it is expected that they will receive a copy. Now, this is somebody who's obviously been involved in the EHR implementation because they use the word workflow. But yes, they should receive the discharge summary. Helen, is there a plan to put QR codes around the hospital that you can sign up to myAlectSelf without an appointment if you have previously been seen at PAH? We haven't considered that yet, so it's a great suggestion. And something, I know we've got it on business cards type format cards, which we have shared, and I've got a load on my desk, which I hand out. But yeah, that's a good idea. We can share that and we can act on that. Thank you very much, and loads of thumbs up for that. So that's clearly a popular idea. Thank you, Helen. Okay. Anyone else with questions? It doesn't sound like it. And no more in the chat. Jill, you have a question?
I don't have a question, but I just put in the chat earlier a couple of links. Firstly, to the information on the Trust website for anybody who wants to have a reflect on what they've heard and read a bit more. Second is the link to the actual welcome screen of the portal, so you can again have a look and see the page that was in Shahid's presentation. And thirdly, we'd be really grateful if you could help us promote the subsequent events that we're running through September and early October, like this, similar format, similar time. We really would love to get the word out there, especially amongst the public, and we will take any suggestions of places we need to go. We've been emailing quite a lot of our stakeholder contacts to help us promote these. So I've put the link in the chat. It's an Eventbrite link. You'll all have subsequent invites to staff-facing teams meetings, and they should all be coming your way too. But please encourage your friends, family, colleagues, anyone you think might be interested and need to know this information to come along to one of our future events. We've got another 4 after this one, 1 each week until the beginning of October. So that would be really helpful. Thank you.
Brilliant. Thank you, Jill. Any other comments or thoughts before we start closing this session out? And I've read patient portal tickets. That sounds really exciting, Jill, when you put that in the chat. Access to another portal. You mentioned that appointments can be rearranged. Is there a maximum time this can be done? So with regard to appointments being rearranged, that's functionality which we're introducing, which is called request-based appointments. That's coming later on. Some of it we are introducing in some areas at this point. And so please look out for that. Is something which is going to be introduced with much more prevalence across all the specialties later on. But yeah, at the moment, of course, if you need an appointment rearranged, the best way to respond is to come back to us and ask us to do that. Can staff register as well? From Stanley, of course you can, absolutely, as long as you are in a live interaction with our services. So if you've got an appointment coming up, you can absolutely register. Yes, the correct word is
Shahid,
encounter.
you can actually sign up if you've had a appointment at any point. You don't have to have an upcoming appointment to be able to join the portal.
Yeah.
You can Google My Alex Health and it will give you the link.
Excellent. Yeah, so it's stand corrected. So anyone who's had an appointment can sign up. Okay. It's 6:56. It doesn't look like there's any other questions from our audience. In that case, we will sign off. Thank you, everyone, very much.